Thanks, Nicole.
So my remarks are not as eloquent as Nicole, so I will start off with that. So I'm Nupur Chaudhury. I'm a program officer at the New York State Health Foundation. I'm also a board member of the University of Orange, and the past board chair of Made in Brownsville, an organization that Justin and I built together with some key folks, which I can talk about a little bit later. So Lourdes started the day grounding us in the place that we're in. And I think one piece that I would like to do is ground us in the time that we are in. So today is February 6th, 2020. Yesterday was February 5th. And I say that because yesterday, Trayvon Martin would have been 25. Trayvon Martin is someone that I think about every day when I do this work. And I think about him because very early on in my career, when he was taken from us, I happened to find myself at a conference, as one does, at the Active Living Research Conference. And I happened to be with a dynamic woman by the name of Siobhan Arlin, who at that time was the health director of the NAACP. And she so clearly helped me understand, and I'll say that I had walked into that conference with my degrees in urban planning, my degrees in public health. I thought I knew a lot. And she taught me why this work around active living, why this research around transportation and walkability. Why did this matter to Trayvon? And I say that because the time that we are in, this day that we are in, we lost this child who I see as our child, this nation's child, for walking. And for walking in a space that someone decided that he did not belong there. I'm so grateful to our comrades from Richmond because, some of the work that has been coming out of that area is one that has been really moving for me. UC Berkeley has the Othering and Belonging Institute, which I've been reading quite a bit about. Where are the spaces and places that we belong? Who gets to decide that? What are the social cues? What are the spatial cues that say that you can walk on that street or you can't? It's been something that I think about in my work, and so after that time that I was with these researchers thinking about walkability and things like that, I had found myself starting to do some work in a community not very far from here, similar two stops away from the end of the 3 train line here in Brownsville, Brooklyn, a neighborhood that is 2.2 square miles, also bordered by a couple of transportation lines. And at that time, 10 years ago, and still today, highest concentration of public housing, highest rate of eviction from public housing, highest violent crime rate. The community understood so astutely how the city did not care about them. And earlier we were talking about, I'm going to see Michelle Obama on Saturday. I'm very excited about this. But if you've read her book, it's an amazing book. But she has 2 lines in that book where she talks about what it was like for her to grow up in Chicago and the turn in the neighborhood around the disinvestment. And as a child, understanding so astutely how the city no longer cared for that neighborhood. So I thought about that as I was doing my work in Brownsville and working shoulder to shoulder at the invitation of a lot of residents there to think about this work around walkability, bikeability, thinking about access to fresh and healthy food, and understanding that really the core of all of it is, do they matter? Do we think that they matter? Do we see ourselves in them? Do we think that they are our brothers and sisters? As someone who is not from Brownsville, I made a very concerted effort to work in solidarity with the folks in Brownsville to understand when I could step forward and use my own power and privilege and open doors, whether it was working with the Department of Health, whether it was working with Department of Transportation or city planning, and understanding when I needed to step back. I share that because the people who are in this room and the people who are watching us online, we are people in this work, and I think we need to understand what is our own power and privilege in this work, specifically when we think about engaging health systems and payers, systems that are mostly white, systems that are mostly employing high-income folks in this work. What are the ways that we can be leveraging our power and our privilege in reconfiguring these processes so that it is not engaging communities in this work? It is opening the doors, and it is reframing this work so that communities are leading us and we are following in that work. I'll stop there.